Hello everybody, this is Tracy Markley again from Tracy's Personal Training Pilates and Yoga Studio in Oregon. And I'm making a video today regarding a question I've had quite often in the last 2 weeks, probably about 8 times, about walking upstairs. And most of my questions have been from stroke survivors who's trying to learn to walk upstairs again. They're having a hard time. Also, just seniors. I have a senior I'm working with right now who's going to be 88, and she's been doing really well. Her balance, her walking, her back feels better, her knees are feeling better, but she said she was still struggling, not feeling safe with stairs. So one of the things that we went over one day, and by the next visit, she goes, "Oh, I feel better now." Making sure you have your core strong when you do stairs. So I'm going to go over some muscles, but throughout the video, I'm going to show different tips on some exercises that help with movement for walking and stairs, as well as trying to make you understand how many muscles are involved in walking and lifting upstairs. But with her, what she was already learning to, keep her abs in and keep her balance. But when she walked upstairs, she was collapsing herself over to look down at her feet. She wasn't keeping this strong, so she wasn't able to keep a strong pelvic to get that movement. And so she worked on her for a few days, and she came and said, "I feel better on stairs." So that's great. Always be safe. Walk sideways down when needed. All those typical things you need to do. But you need to get the right muscles strong for stabilizing your core, the hips, the pelvic. This needs to be stable for this kind of movement to take place. So I'm going to show all kinds of muscles, but just a couple I'm going to show first is your glute muscle. And if you guys have watched my other videos, and those who have read my books, I have specific chapters on muscles, showing the muscles, why these muscles need to be strengthened to help you for walking, standing, and getting your everyday movements back. If you're a stroke survivor, and also, well, for anybody, but if you're a senior or anybody who's just becoming unstable in their walking, you're losing your balance, you're losing your spatial awareness, you need to build the muscles back up to do the movements that participate in the job of walking and being stable. So we're going to go to the glutes real quick because they're in my hand. Here's your glutes, which is your butt muscle. You got a gluteus maximus, minimus, and oh my God, I forget the name of it. They're all 3 muscles. Anyway, I'm tired today. That's so funny. I forget. They're there. I'm just not thinking clear right now. You take off that big butt muscle, the gluteus maximus, and you have all these little ones underneath. And so you got the maximus, the medius, and the minimus. Okay, there you go. We all forget the muscles, but they're in my head somewhere. Anyway, for movement, though, they all do different things. So when it comes to walking and going upstairs, your glutes, they help. Besides the rotation of the hip too, they help with extending the femur. Your femur is the large bone leg in your upper thigh. Flexion is this. Extending is back here. So when you take steps or you're going backwards and you're moving, this movement's happening. When you go up a step, you have to bring one leg up, come up. This one kind of lifts back. So you need the whole package of movements. It's not just work the front of your leg. It's the whole unit of your body. You need the core, the spine, the pelvic stable, your glutes working, your thighs working, your hamstrings working. So it's not just a simple task to get back. It takes a package of exercises to put the body back together. They work together as a team. And there's several muscles involved in the body in walking. Well, that includes stairs, because it's not like everything stops. Everything's still flowing when you're moving. So let me just show some muscles that are involved in movement. So I was talking about, to lift the leg, you have to flex that femur, meaning the femur is coming up. What helps flex the femur? The psoas muscle helps flex the hips and the femur. The hip flexion is like when you squat. You bring any time in this movement, hips, quads, femur flexion, your you're bringing those angles together for a movement, whether they're little movements to step up steps, movements to walk, lifting up on something higher, or squatting. Okay, so the movement of this and stepping to come up, you're going to involve all your quad muscles. You have 4 quad muscles. This is the front of your thigh, your quadriceps. And the sartorius muscle, which is the red muscle highlighted here. It attaches at your hips, crosses, trying to get back to you, see me, over your thigh and attaches right beneath your knee. There's a lot of muscles involved. And in some of the videos, I have showed how you could sit on a ball or a chair and squeeze a little ball and as you're sitting. That helps work the psoas muscle, the sartorius muscle, and some of the inner thigh muscles. And other ones, you have another layer in there that pulls the leg in. So when you're walking, you have a layer of muscles there that hold the femur insecure when you're walking. And that's the pectineus, and some other muscles that's in another video. They're in my books. My newest book, The Power of Your Spine, shares, I'm gonna get a colored one. I have a colored and a black and white version. It shows the muscles that are needed, and all the muscles I'm showing you here, they're in here. And they're showing you what they do and what movements they help you with. And there's a lot of muscles in here for movement and walking. And right here, I don't have the big picture of it. Those muscles right there, and so this would be your pelvic right here. And here's your pectineus and some other muscles right in there. They help hold your femur in when you walk to stabilize your femur, which you need that so you're not doing this. When you're walking upstairs, if you don't have stability in that leg, you're going to have even a harder time. And if you're a stroke survivor and you have spasticity in that leg or your hip or that psoas muscle I've talked about that comes up here, you're going to have a harder time. So you have to exercise the right muscles, work through the spasticity however you can get there. Everybody's different. Everybody has different things going on. But here's the psoas muscle. I cut it out so you can see movements. So this muscle, which I share in the books, in all my videos, in the stroke recovery and exercise course I've written for the fitness industry, the MedFit Foundation, I go over all of this so fitness professionals can learn deeper in depth so they can help seniors and survivors in helping people put their body back together. If you do not know the anatomy and which muscles do what movement, you're not going to be able to help people besides just general 3 sets of this and little exercises here. You're not going to be able to help put someone back together or truly keep someone in fall prevention exercise program. The muscles and knowledge is essential. So the psoas muscle, which I've shared before, it attaches in your low vertebrae, crosses over that hip bone, and attaches your femur. So here's a little tiny version of it. So here's your low spine, here's your pelvic, and when you walk, it moves with you. When you bend, when you squat. So if you're walking, I know it's tiny here, but if you're walking here or trying to walk upstairs here, the muscles involved that you need, you're flexing them, and then you're trying to make them work to pick your leg up. It's not going to work. We need to get your core strong. And as I shared in my books and my videos, core doesn't just mean getting a six-pack. It's getting your deep spine muscles strong. The deep spine and the rotating spine muscles. There's so many muscles deep in your spine. And then your transverse and the psoas. There's just layers of muscles in the center of your body that needs to get strong to stabilize you for walking and walking upstairs and sitting up tall, standing up out of wheelchairs, getting your movement. And this is just showing what's going on in the back of your leg. So here's your glutes right here. Then you got your hamstrings. This is the back of your leg. Then you got your calf muscles. There's a lot of muscles involved in walking and stepping up and down stairs. So it is a task to get that back. It's hard work. It's a bundle of a bunch of exercises and ways to get there. And I can tell you more individually what would work for people individually, but I'll give you some tips. If you go through my books, read the books, understand what's happening, you can put things back together better. And then when watching my videos, some of the things I can show. But you still have to know your body. One thing, if you have spasticity going on and you're in here still and you're here a lot, or you just need to strengthen it here, because if you've been sitting in a wheelchair and you're sitting like this all day long, 8 hours a day, on and off, and you get up to walk and you want your body to be here to walk and to walk upstairs, it's going to be harder for you. So make sure when you sit, you keep this lined up, because the positions your body's in longer is where your body's going to try to work in the most. So if you're sitting like this all the time, but then to move your body and movement, you have to be here and walk, or here to step up steps. It's not going to have any functional strength to work to the proper mechanics needed for it. So watch how you sit. Watch the height of your chairs. I've explained in the books and also in the videos. The height of these chairs, how you sit, your position. So here's just another muscle. This helps stabilize you in walking as well. So you got the psoas that comes down here, I just told you. Then you got the quadratus lumborum. When this is squished on one side, you made your body into scoliosis. Your spine's crooked. That can be straightened back out. Some people have spasticity somewhere in these muscles. It could be the psoas. It could be the quadratus lumborum. It could be some of the tiny ones. When the spasticity hits and strokes, it can hit everywhere. It's not just spots. It's muscles and different muscles going on. So watch my other videos, get my books, and try to really understand what's going on, because it will help you. Okay. What I have done to help people with stairs, first I go here first. So all the stuff I've shared in books and in my other videos about strengthening your core, mandatory. It is a must, because you can't walk and step upstairs if your core is like this, or if your core is crooked. You have to get this strong. And I do that by working with Bosu balls and bounce discs and sitting on Swiss balls, depending on the level of the person, and teaching them to connect to their posture. Getting your posture connected, your balance, stability, and fall prevention, all in that same package. Okay, so I have a bar here, and I have a little step. It's a thick wooden step that we used for something else. I think it was for my parents' cat to get up on the bed. But it's all carpeted up, and I have them now. But they're excellent for practicing. So if you can see me, I know the video is kind of far away. I have a bar here to grab onto. So when you step up, especially if you've had weakness on one leg, back issues, major sciatica stuff, or one leg's a lot weaker for whatever reason, or you're in stroke recovery and you have the one side that's just weaker, even though both sides are weak, there's always that one side that's more. You have one, when you step, so you have one leg that has to support you as you're lifting this leg. If the leg you're lifting is weak, it's going to be hard to maneuver it. But then if you're trying to stand on that leg and you have the leg that's working better, can have the movement, this leg's not stabilizing as well. So you have both sides going to have a struggle for those reasons. So when you step up, those muscles I explained, that you have to flex that femur. So this, you need to get this pelvic stable so this can lift. And the pelvic needs to be stable for the movement to come back, because this, your glutes, all these muscles, you have all these movements that move for walking and lifting. So over here, you're going to have one leg stable as you pull yourself up. If you have a bar to work with, you can try in a safe place where you can keep your hips stable and try to pull yourself up and down with your pelvic stable and your abs engaged. So it's going to be different to come up like this than to use your core and stand up tall. So you can do it sideways. It depends on your ability. Some people may need to work on it with both hands on a bar, or if you can do something holding on tight and practice here. But you have to, somewhere in your program and your therapy, strengthen your core and your psoas and your glutes so this movement can help you lift up and down. Another thing that may help you as well is standing and working on lifting your legs. But you need to do it in proper position, and it will be harder if this is really weak. So work yourself into it. Work on keeping your abs engaged. Do the things that I have taught you in the books and other videos. Get your deep spine strong and work your way through, because you have to build your body back up. And the more natural mechanics of building it up for the brain to get the new pathways, it's going to work better. You won't learn to step upstairs and walk very well if you're sitting all the time. And I know some people can't stand, but if you're in the place where you can learn to, you can work on standing, and you have the you're at the level you can stand and you can move and you're needing to walk, these things can help you. Another thing that may help you is working on your lunges. I have a video on lunges, and it's also in my book. And again, always have proper abs. At no time are you collapsing in between movements. And watch my other video on how to do proper lunges and proper squats. The lunges is really important, because if you can get yourself to work on this movement properly, this will help with your core, your hamstrings, your quads, this motion with your legs separate instead of in a squat as well, because when you step and you go upstairs, both legs are doing something different. When you're in a lunge, both legs are doing something different. So whether you're on a bar or not, you want your body down and up. Watch the other, I have a good video on that in here in my YouTube. Another thing, working on those glutes. Some people can get to the floor and do some of the Pilates exercises, or whatever modality you call it. Basically, it's doing pelvic tilts, butt lifts. If you can, I don't know, see me from way over there, you can do things on the floor if you can go to the floor. You come down here, engage those glutes, lift up and down. You can do it with your legs straight. Those exercises assist in walking and building the glutes in that movement. But some of you guys can't go on the floor yet, but there's a lot of options to get there, and you have to go with what you can. And you may not be perfect at each exercise as you do it, but as you keep working on them, you get stronger at them. It's like if you want to get big biceps, and right now you can only do a 3-pounder, where in order to get to the 15 or 20-pound weight, you have to work your way up. And for anybody, the stronger your center is, the more weight bearing and movement your limbs can do safely. You have more power and more strength. So you have to get this strong. I have a pile of muscles there to show you, but I just showed you some today. But again, every book I have has a chapter on muscles, and each book I make has more. The latest book, The Power of Your Spine, talks about all these muscles in here, all the muscles around your spine and your core, what they do and what movements they help with in rotation and everything, because there's a power in your spine. There's this power here, and this has to be strong. And I have a really good video to show you guys about that, and I don't have it with me. I will bring it and show you guys. I shared it in the stroke recovery support groups a few times. It's not a video I made, it's someone else's. It's basically a man that has no legs and no arms, and he's walking. And your spine is like it's spinal engine. It's a theory. It's real. When you walk, you move through here. So this man's walking with a strong upright core, with no legs, just on the parts that's there, and walking the little part of the leg he does have. That is proof the power in here for walking, standing, lifting that leg, moving that leg back, all these different things. Another way you can work your glutes, if you are able and you can't go to the floor, you can stand and hold a bar. Zip up your tummy, always in good form. And I'm going to turn the angle you can see me. Turn that foot out, lift from that glute, little tiny lifts. But it depends on your hips and your mobility if you're able to do that. So again, when I'm with people in person, I can work with you exactly what works more for you. In my videos, I'm just trying to give you ideas and guidance because I know there's not a lot of good guidance out there. So I'm hoping this helps you. Anyway, I really hope this helped. Please watch my other videos, like the YouTube channel, all that stuff we always say. But as for my books, let me go through them real quick for those that don't know. I have 4 books. The latest book is The Power of Your Spine, How Back Strength and Posture Pilots the Entire Body. And it's basically an anatomy book, but you can go in there, but it tells about the muscles too. But I mean, it tells you a little more, but it will show you the muscles, where the muscle attaches, what movement it does. And it helps you put your body back together. I have the more than just the spine in there. I have some of the biceps and triceps back here too, but it comes in color and also black and white. You can order from me or on Amazon. Really good book for fitness professionals or therapists or massage therapists, yoga, Pilates teachers, whatever. It's a good reference. I know a lot of basic personal training barely covers any muscles. You need to know this. And it's a small book, easy to read, easy to carry. If you're been in pain or you're going to acupuncture or you're going to a massage therapist, you're going to your chiropractor, and you want to understand what muscles are tight, and you guys want to be in the same page of your healing, pull out the book and say, show me which muscle that is. Then you can maybe go to your massage therapist, say, my chiropractor says it's this one. Get your healing all on the same page with people, or your therapist, or whatever you're working with to get better, whether it's back pain or stroke recovery or whatever reason you have. Knowing your body will help you, and communicating with the people trying to help you will make it easier and helpful. And it doesn't expire because you're always going to have these muscles. It's not like this is some fad that's going to go out next year and you're wasting your money on it. Okay, my very first book was The Stroke of an Artist, The Journey of a Fitness Trainer and Stroke Survivor. Those that know me already kind of know the story, but basically he was a stroke survivor I trained that wanted his story shared very badly to help people. I met him in a walker at 6 months post-stroke, and he went from not being able to move his body at all, thinking he's not going to live the first 2 weeks, to by the 3rd year with me, he was walking across Bosu balls, standing in Bosu ball, bouncing balls. But before that, he couldn't even sit on a ball. He had drop foot, dragging that foot, rotator cuff injury, a knee that kept extending. It took him a few months to remember my name. So he went through a lot to get better. But he got to the point where he was one of the guys in the gym that would walk up to other people and say, don't give up, you can do it. You should have seen me, I was a mess. He had a good sense of humor. Anyway, that's a helpful book. Stroke Recovery, What Now? When your physical therapy ends, but your recovery continues. This, again, had all these chapters. All of my books have chapters on muscles. Each book gets more into it. So this is my 3rd book, but it has the glutes, the things I shared here, and this one also has a lot of the exercises that I help stroke survivors with. So, good one to have. And it also explains things. It helps you understand your body and how you can get movements back. Because if you don't understand why things aren't working, it's going to be hard to put it back together, or to encourage your brain to make movements with the right muscles if you don't know which muscles make a movement. My 2nd book was Tipping Towards Balance, A Fitness Trainer's Guide to Stability Walking. And this has some of the exercises in the stroke recovery book as well. But this is when I had some seniors coming to me in town who are tripping and falling, losing their spatial awareness, which is also in all my books too, because spatial awareness, balance, stability, knowing where your body is in space so you can lift your foot high enough to not trip on tree roots when you're hiking or in your house or stepping up stairs. Because when you step upstairs, you have to clear that step going up and down. So getting your spatial awareness back is very essential with your core, but it's all connected. If you see my videos and my book, especially the Stroke Recovery Right Now book, it will really help you if you're in recovery. Anyway, so this was helping with exercises and these are all fall prevention things too. Anyway, most of you guys know that. Maybe you don't. Maybe you're just getting to know me, but that's about me, and I've been doing this for over 20 years, and I've recently, in the last year, written a stroke recovery and exercise course for the MedFit Foundation. I'm going to be speaking in Irvine, California in February, a 4-hour course course on stroke recovery and exercise, covering as much as I can to help teach fitness professionals to know more, because it's such a desperate need right now to get more care and help and helping stroke survivors and their caregivers put their their loved ones back together and moving again, getting maybe driving again, when movement, lifting, walking, all those things. And there you go. So I hope this has helped you. I hope it made sense. A few things. If you don't have a block to use, if you have the balance pads, which are really good, you can practice on little ones. Maybe get 2, practice stand. You can step on 2 at a time, stepping on them, stepping down. Work on the things in my videos and in the books. You cannot build skills back like these movements for things you need in life if the whole center of your body is here. If every time you take a step and your abs are in, but then you crash down, then you stand back up, it's not going to help you. You need to get this strong. And this is for everybody. All of us. Sports for kids, people, athletes, they're doing the same thing, but at their level. Everybody has to have the center strong. That's how walking gaits, proprioception, where your body is in space, not falling down, fall prevention. It's like the base to everything we need in life for your body to move. So have a great day. Don't give up. And I really hope this helps you. And I'll see you in the next video.